In 20 years of practicing medicine, I have observed a consistent phenomenon that occurs in the lives of those physicians who become cynical and bitter, who experience burnout, who lose vision and purpose. That phenomenon is a disappearance of gratitude and its replacement by entitlement. Those who feel profoundly entitled have difficulty being of profound service. We physicians have much to be thankful for. And in the words of the greatest healer who walked this earth, from those to whom much has been given, much will be expected. Last month, I attended the annual meeting of the American Pediatric Surgical Association. Many of my colleagues shared their relief experiences in Haiti in the middle of the most devastating catastrophe in recent human history. One experience in particular, however, stood out in my mind. It was that of Dr. Henri Ford, Surgeon-in-Chief at Children's Hospital Los Angeles and Associate Dean at the USC School of Medicine. Dr. Ford is a true leader in pediatric surgery and American surgery in general. He has attained the highest levels of recognition for his research and clinical practice and is on the governing bodies and boards of many of the most prestigious surgical organizations. But Dr. Ford spoke about the sense of significance he had as a Haitian American surgeon returning to Haiti in the middle of disaster. It was a sense of significance, perhaps never duplicated in a long and illustrious career. He felt that perhaps all the accomplishments in his life were for a time such as this, that he had been given so much and this was a time to give back. In Haiti, Dr. Ford was just a doctor taking care of human beings who needed him. That is where medicine starts, and that is where it ends. Those are the bookends between which lies all other endeavors of a physician. And so, in the remaining few minutes I have on this podium, I would like to share my reflections on the path that lies ahead of you. You have been motivated by the pursuit of excellence, for without true excellence you would not have been here today. And although you may have some trepidation about the beginning of your residency, the amount of information that's still to be acquired, the long hours that lie ahead, etc., you will continue to be excellent. For excellence is part of your fiber, it's in your genes. But is the continued pursuit of excellence enough? Is it enough to keep you motivated? Is it enough to keep you attracted to medicine? Is it enough to see you wake up every morning excited about a new day? In an editorial on the state of medicine and surgery in this country, published in 2005 in the American Journal of Surgery, Dr. Joseph Fisher, a pillar of American surgery, and the chair of the Health Policy Steering Committee of the American College of Surgeons at the time, stated the following, quote, "There are only 4 forms of incentive that I, now in my 27th year as a surgical chair, recognize. Cash money, and anything that can be converted into cash money." End of quote. While I appreciated Dr. Fisher's candidness and experience, and while his statement in some ways allowed me to better understand my work environment as a young surgeon, I disagreed. I had to disagree. I have to continue to disagree. We have to disagree as a medical school, as a university, as a profession, as a community, as a state, as a nation. Physicians should be compensated well and very well for the delayed gratification, hard work, stressful lives, daunting responsibilities, and the debt burden many of you will carry. But if we decide that doctors can only and will only be motivated financially, then we will violate our core principle embodied in the oath you are going to take today. I will practice medicine for people, not for things. It is an oath that has kept us a noble and revered profession for centuries. An oath that motivated our predecessors, Osler, Banting, Penfield, Halsted, Folkman, Starzl, to keep moving forward day after day despite disappointment after disappointment. An oath that has sent volunteer physicians to the far outreaches of this earth to take care of people whose language they could not speak and whose culture they could not understand. An oath that compels relief physicians and surgeons to risk their lives in war zones and violent regions in this world in order to provide help to people they do not know. An oath that continues to attract the best and brightest to medicine. And so, if it's not money or cash money, what can it be? I believe the age-old motivator of physicians is significance. Yes, significance. I believe that God Almighty has endowed us with the desire to be of significance to other human beings. I believe that the desire is exceptionally strong among physicians. I believe that as doctors, it is more important for us to be significant to even one human being than to be irrelevant to multitudes. The most content and fulfilled physicians I have encountered have not been those who have amassed wealth, but rather those who have made the biggest difference in the lives of others, whether in the African bush, the Indian reservation, the inner city, or right here in Orange County. I grew up with two of those physicians, my parents, who served some of the neediest human beings in Egypt and Nigeria without ever putting a price on their services. I also believe that the desire for significance can either be extinguished by cynicism, selfishness, greed, corruption, or it can be nurtured. Nurtured to create physicians that are significant to their patients, their practices, their communities, and their country. And so, class of 2010, how will you nurture your quest for significance? You will each have to examine yourselves to answer this question, and each of you may have a unique answer. But, and I'm sure you won't be surprised, I have a few suggestions for you to consider. First, the golden rule of medicine. Treat your patients as you wish yourself, or your child, or your parent, or your sibling to be treated. There will be some patients who will remind you of that member of your family you may not be so fond of. But remember, he or she is still a member of your family. When you can't cure, remember that you can often care and always comfort. Do not worry when you can share your patient's emotions. Worry when you can't. The families that have bonded with the most have not been the ones who experienced fast cures, not the ones who underwent pioneering procedures, not the ones who benefited from the latest research findings, not even the ones whose children I saved from certain death. The families I have bonded with the most have been the ones whose children's funerals I have attended. Be significant to your patients. Second, pay your teachers and mentors forward by teaching and mentoring others. Despite all the advances in technology and teaching science, medicine remains an apprenticeship. We acquire it from our predecessors and pass it to our successors. You do not have to be an academic physician to teach. Regardless of the practice environment you will find yourself in, there will always be someone around you hoping to learn from you. It may be a nursing student, a surgical tech, a fellow physician. Seek them out, encourage them, inspire them. Be significant to them. Third, be always inquisitive. Research is the tool by which medicine continues to advance. Some of you will progress to become funded and established and dedicated researchers. But research is a spectrum with plenty of room for different degrees of involvement and commitment, and you can choose how much you want to do. Even the occasional case report adds something to the body of knowledge. Keep an open mind. Ask the difficult questions. If you have an idea, pursue it. Embrace innovation that truly benefits the patient. Evidence-based medicine is the call of the day. Seek the evidence. Use the evidence. Create the evidence. Be significant to your profession. Finally, Dr. Prislin, please stay involved in issues of healthcare policy. If you think we have just passed healthcare reform and we can all rest, think again. We have not passed healthcare reform. We have passed healthcare expansion. It is too early to judge how this will affect our future, but it's not too early to know that much work lies ahead. Make your voice heard in the national debate that started in your senior year and will almost certainly rage on. You know, it was interesting for me, as an American physician practicing in Canada, to see the recent negative depictions of the Canadian system in TV ads and lay media. Depictions that bore absolutely no resemblance to the actual environment in which I practice daily. My reality is very different. I can see any patient and any patient can see me. My patients' parents have peace of mind regarding their children's health. If they change jobs or lose their job altogether in a bad economy, their children will still get the same care and see the same physicians.